And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. For today, we'll give an update on the number of new cases. Also, a little bit of a change in some of the data and how we're getting it, given the changing situation that we've had in BC, and also, as you saw yesterday, our plan for how we're scaling up the response in the different hospitals around the province. Our number of new cases that are test positive today in the last 24 hours is 92, which brings us to a total of 884 test positive cases here in British Columbia. That includes 444 in the Vancouver Coastal Health Region, 291 in Fraser Health, 60 on Vancouver Island, 77 cases in the interior, and 12 now in the Northern Health Region. In addition, we're up to 12 long-term care homes that have had at least one resident or staff test positive for this virus, and that's 6 in the Vancouver Coastal Health Region and 6 in the Fraser Health Region. And as we know, whenever we have even a single case in a long-term care home, the full outbreak protocol is being implemented in those homes across both, mostly in the Lower Mainland, as we know. So in terms of people in hospital, we have 81 now who are hospitalized in the province. And the new numbers that we have are helping us get a better understanding of hospitalizations. And it really is more of how we're collecting the data. So both for hospitalizations and for ICU. And as of today, we have 52 people who are in ICU with COVID-19 across the province. We also have one additional death in the Vancouver Coastal Health Region. On a positive note, we now have 45% of our cases have fully recovered, and that includes 396 people who have had COVID-19 who are now recovered. Want to talk just a little bit about some of our response efforts, and I know I get a lot of people who are saying we should have a lockdown as they're doing in some other places, and we have talked a number of times about how we're doing things here in British Columbia, and really we've done very similar to what others are calling a lockdown. We have done it in a more strategic way, or we've tried to do it in a very thoughtful and purposeful way, rather than having blanket restrictions on certain things. And one of the ways we, for example, how we closed the in-classroom schooling, but really the importance of being able to support both essential workers like healthcare workers and grocery store workers and others to be able to continue our essential services. We need to have the ability to care for children, and that is what the Ministry of Education and our school districts are working on. In addition, it's important for us to make sure that we have those supports in place for the children who are most disadvantaged by the closing of the physical classrooms. And so that is also something that the ministries are working on very thoughtfully in our province to make sure that we can best support those who are going to have the most challenge in terms of bouncing back from an extended closure. We also, the purpose of what we've been doing is to try and reduce the exposure for those who are at highest risk, and to impose those physical distancing in all of the places that we can to try and minimize the transmission of this virus across the province, as you've heard me say again and again. And really, we have seen in our communities extraordinary community goodwill and compassion and care. And, that is what will get us through these next few weeks. Our cases are continuing to increase. We know that. We know that people who have been exposed in the last 2 weeks are continuing to get sick. And these measures that we are doing now are designed to try and prevent those transmissions from those people to the next generation. But any severe outbreak or cluster of cases is going to tip the scales for us. And we are at that very critical point right now where we need to continue this action together. We must stay apart with our physical distancing. We must stay home if we're ill. We must be united in this and 100% committed until we flatten this curve for good. Now more than ever, we need you to keep this up. And I just want to also say that, we do appreciate everything that everybody is doing right now, and that is what is going to keep us going for these next few weeks.
Thank you very much, Dr. Henry, and I wanted to just provide some other health information numbers and systems numbers from across the system as well. As Dr. Henry has said, we now have 884 cases. That's an increase of 92 over yesterday. 396 recovered cases, which is an increase of 121. And 81 cases in hospital. And just with respect to the hospital numbers, that's 31 cases in Vancouver Coastal Health, 39 cases in Fraser Health, 6 cases in Interior Health, 3 cases in Island Health, and 2 cases in the Northern Health Authority. There's interest in the number of hospital beds available. Today, the total vacant beds across the healthcare system is 4,295, which continues the work that we described yesterday to prepare the healthcare system for what we expect to be more cases in the coming weeks. As well, there's, I think, significant interest in the number of people re-registering in the healthcare system. We now have 28 new registrants as of yesterday amongst doctors, 309 in nursing that include registered nurses, licensed practical nurses, registered psychiatric nurses, nurse practitioners, and healthcare assistants. We also have a significant re-registering in allied health, and we thank all of those who've re-registered for their commitment. I also want to point out that we have significant increases in the number of responses in our ambulance service to influenza-like illnesses, and while overall calls to the ambulance service are down, I just want to acknowledge the extraordinary work of the ambulance paramedics of BC, of QP Local 873 across BC, which has, I think, been extraordinary. Finally, I want to acknowledge last night in Interior Health, the work of the opposition health critic, Norm Letnick, who hosted an event last night with Susan Brown, the president of the Interior Health Authority, of Dr. Sue Pollack of Interior Health. We did an event last night which shows, I think, our joint commitment
Saturday,
to the work that we
March
need to do
28th.
together. Finally, I have to say that, again, we have to be 100%